Hello, this is Sitrep, and I am Informed PH. And today we have a very special guest, and we have with us today on a rainy day in Manila is to talk about his advocacy, to talk about his upcoming project. We have Captain Medin Velasco, or Captain Med for short. So a little intro about our special guest. So he is an aviation expert with a fascinating journey from the Philippine Air Force to international medevac flights. So you can add to what I say, Captain Med. So he was born in Iligan City and was raised in Cagayan de Oro. So he graduated from the Philippine Military Academy in 1972, then served as an am I correct in pronouncing this? F5A fighter pilot. He was an air rescue pilot, yes, and an intelligence squadron commander. So he moved to Canada in 1980. And yes, please continue. Continue, Captain Med. So
Okay. So in
from the time
1980,
you went to Canada up to now, yeah.
right, I moved to
Go ahead.
Canada to join my family. My children were born there. So I finished my mandatory 8-year contract with the Philippine Air Force. And in 1980, I moved to Canada and started flying there commercially.
Mm-hmm.
Since I'm qualified in both helicopter and fixed wing, I flew commercially in both. And ultimately joining Transport Canada and flying airlines both in Canada and in the Kingdom of Bahrain. And in 2021, December 31, I retired, and I was just in Canada flying privately. But I maintained my medical category 1, so I'm still able to fly if I need to. And now I'm here. I'm trying to bring the program for our air ambulance for the Philippines for the first time.
Okay, Captain Med,
Okay.
since this is a recording, can you check your settings and uh, go to audio and then
Audio.
reduce echo cancellation. Yeah, audio. And then reduce echo cancellation and check
Okay, just
check mo yung
on
echo
the settings,
cancellation.
right?
On the
Audio.
settings audio, and please check echo cancellation and reduce mic background.
How's that?
Check. Yeah, check it.
Is that
Okay.
better?
And then yeah, and then mic volume is, put it to 200. Okay. So okay lang to kasi it will be removed from
Okay,
the
edit.
final video. Captain Med, yeah. Captain Med,
Yeah.
you have a better audio now. So can you start
Okay.
by sharing the vision behind what's the name of your initiative? That's the first
It's
question.
the S.T.A.R.S. Philippines. It's an air ambulance
Yes,
service
and
NGO nonprofit.
mhm. So can you start by sharing the vision behind Stars Philippines, and what inspired you to launch this project, this personal
Yeah,
project of yours?
yes, Alex. Leveraging on my 40 years experience in Canada as a motorbike pilot, I thought of bringing it to the Philippines. We're in, it would be a charitable program. Can I stop? It's echoing on my ear. There's something wrong.
Sige, sige.
Is it echoing in your side?
No, no, no. Do you hear an echo on your end?
Yeah, the echo cancellation.
Yeah,
I'll put in.
better check. Yeah, i-check mo and then put away your phone, baka nag-echo. Are you using laptop?
Yeah, I'm using laptop.
Mm. Okay. Sige.
Okay, just okay. That's okay. We'll try again.
Okay, can you for our first question of this podcast episode, Captain Med, please can you start by sharing the vision behind Stars Philippines and what inspired you to start and launch this project of yours?
Yes, leveraging on my experience in Canada as a medevac pilot for approximately four
Mhm.
years, I decided after my retirement to bring it here. We're in it's, an NGO, a nonprofit organization, so that the victims will not have to pay the exorbitant amount. So, to create an effective emergency service for critical patients, especially in remote areas, ensure timely medical assistance accessible to all Filipinos, inspired by the air ambulance service in the countries like Canada, which I worked for so many years. This will enhance healthcare infrastructure, including organ donor program, foster collaboration among health agencies, government, and communities. And lastly, build a sustainable air rescue program prioritizing Filipino health and safety.
Mhm. Okay, thank you for that, Captain Med. Okay, second question tayo, but I think there is still some kind of echo on your end. I will
Is it?
remove itong, who is this another Captain Med on the StreamYard? Is this your phone, itong session? Baka lang nag-echo kasi because of that.
Is that right?
This, okay, you are connected through your phone or another session?
And,
It,
but my phone is close by.
oh sige, I will remove this baka ito yung phone mo. Kasi nag-echo eh. Let me just
Try,
fix this. Okay.
yeah.
Okay.
Try removing that. Now there's none.
Now
Now it's better.
it's more
Mic test
oo.
one, two,
Tapos
three.
yung phone mo, yes. Mic test, mic test.
Mic
Okay.
test one, two, three. That's better.
Okay.
Holy cow, that's
That's better, yeah. Don't worry, we can omit this part as
I
long
know,
as
I know. Thanks. Thanks that we
yung ano
have that
natin yung
yeah.
oh, we're not live so hindi tayo pressured to do a live.
Yeah.
Be in a
Perfect.
live and repeat things, yeah. So okay, for the second question, Captain Med, can you explain how does the air ambulance system work? And in layman's term, what are some of the key components that make it operational once it goes operational? In our country, which is basically an archipelago. So
Right.
make explain it to our listeners in a way they will easily understand the concept of air ambulance. Go ahead, Captain
Yeah.
Med.
Okay. We have to establish a structure of the whole country because we want to cover every island, every including West Philippine Sea. So there will be strategically located, coordinated air and ground ambulance network all over the
Mhm.
country. We were thinking initially maybe 25 helicopters from Batanes down to Sulu or Sanga there and Davao.
Mhm.
Diverse fleet of helicopters and fixed-wing aircraft for various terrain. Flight staffed by trained medical professionals, paramedics, nurses, doctors. Centralized dispatch
Mhm.
center with advanced communication technology. Collaboration with local hospitals and emergency services is very vital. Ongoing training for local responders enhances effectiveness. Strict adherence to aviation regulation and safety protocols is essential. One of the things that I'm always telling everybody, Alex, here is safety is paramount in our operation. We we cannot afford to have even a single incident. So it will
Mm.
be professionally run. That's why we're establishing a training academy in Angeles or in Clark, so that our pilots will be training there, our medical practitioners will be training there as well.
So you mentioned about but some places in the Philippines. So and you mentioned about West Philippine Sea rather. So what regions or communities will most benefit from this stars Philippines, you call it, right?
That's
Initiative.
correct.
And
Yeah.
how do you plan to also include, isolated areas of the Philippines? Is it nationwide? So
Yes, it is in
mm,
every corner of the Philippines. Our data, because I did the research from Canada, is not as accurate. So now
mm,
that I'm here, I'll be working with our local, research and statistics, and will tell us where most of
right.
our populace and where we can position this bases of helicopters. So there are, let's say,
Mm,
there'll be a base in Baguio or in Davao, and its coverage will be approximately 300 kilometers, right? So, and aside from that, every helicopter will have several ground ambulances that will support it. So, we're really establishing a structure for ground and air ambulance, collaborating with our local hospitals,
mhm.
clinics, and the local government.
So you basically the concept uh, is also been used in Canada. So how was it? How was it there? Like uh, this concept of air ambulance. Tell us if it's a successful if it's success. How did it become a success in Canada in terms
Right.
of providing this kind of uh, service to the Canadians?
Right. We're replicating the very successful medevac program called S.T.A.R.S in Western Canada. What it
Mm-hmm.
is they are the medical emergency responder to 911 calls. In Canada,
Right. Mhm.
uh, every time somebody calls 911, there are three units that respond to that call. It's automatically. That will be the police,
Mhm.
fire responder, and medevac. So,
Right.
if if it is medevac, they will specify whether it's ground or it needs air assets, because sometimes it's not accessible, or it's better to
Mhm.
use air ambulance because of the golden hour. We believe in the golden hour. In if we can treat the
Mhm.
patient or victim within the hour, their recovery and also survival
Mhm.
rate goes up
Mhm.
much better. So in Canada, the S.T.A.R.S program there has been operating for the last 40 years, and they have saved
40 years.
lives, approximately 50,000 people, for the last 40 years. But the reason why
Mhm.
pattern and a way to replicating the Western Canada S.T.A.R.S, because it is it's a charitable program compared to the others in Ontario or British Columbia, where it is for profit and they have
Mhm.
contract with the government and the 911. The Western Canada is not for profit NGO. So I thought this is the best program that we can bring to the Philippines, so that the victims or the people who will be using this when they call 911, they're not hesitant to call 911 because of the exorbitant fees in using the helicopter or our ground
Mhm.
ambulance. It will be charitable. There's an accident, it's not what do you call this one?
It will not be expensive and difficult for
Yeah,
the average Filipino to avail this kind of
that's correct.
service.
Be- That's correct, because later, Alex, we will be discussing how are we
Mhm.
gonna pay for these services, because helicopters, and ground ambulances, and doctors and paramedics are not cheap to, to operate them,
Correct.
right? So,
Of, of
so
course.
I
Yes.
will tell you the revenue streams, how we can do this, and hopefully it will, it should work in the Philippines. I think this will be the best program that we can bring to this country here, because it will be for
Mhm.
all, not only for the wealthy or for those who can afford the helicopter or the ground ambulance.
So this concept of air ambulance, was it, uh, were there any previous companies who tried this similar concept here in the Philippines, or this will be a new concept if you are going to put this up in the near future
This will
successfully?
be a
Yeah.
new concept. This will be a first time because it's an
Mm-hmm.
NGO. NGO is non-government organization, and
Mm-hmm.
it will be non-profit, non-stock organization that will have a contract with the government that will respond to all 911 calls. The reason why I'm saying this is the first time, we have air ambulances here, but they're for profit. They're corporations, right? So they don't respond
Right,
to
right.
one unless they will call them, because you have to pay the services. Uh,
Correct.
Actually, I'll give you a background. I tried to bring this program, a similar program, in 1991. It was the Philippine Air Ambulance, and it was for profit. We were registered with the Securities Exchange Commission, but it was for profit.
Mm-hmm.
And after a while, I was realizing, we're servicing the wealthy of this country here, but not the poor. And I don't want to uh, go to an accident scene and looking at the victim saying, can you afford to use this helicopter? I think that's not right, right? It should be, if there's a victim, we should be able to help them and save their lives. And so, this NGO, nonprofit, I think, charitable organization of S.T.A.R.S is the best, similar to Western Canada. But anyways, let me give you a story about the 1981 when we
Yes.
were operating here.
Mm-hmm.
We were operating for about a year and a half until we shut it down.
Mm-hmm.
One night, as I said, I had a phone call from a lady who were a little bit frantic and was asking for the use of the helicopter. And I told her,
Right.
"Oh, why don't you call the helicopter, the Air Force, so that it will be free?" And she told me, "Well, no, they're not flying at night. It was nighttime." And she was telling
Mm-hmm.
me, I told her it's gonna cost you quite a bit of money. Maybe I can't remember the exact hourly rate at that time of our helicopter. It was a Bell 407 helicopter, a single engine, but we can use it for night flying. And she said, "I don't care how much, we want to use the helicopter." So we launched our helicopter.
Right.
It was it was flown by our captain Albano, and
Mm-hmm.
the accident was in Pangasinan, somewhere in Pangasinan. I couldn't remember the exact place, but I called the local police and the hospital there. I said, "Could you prepare?" It was near a school there. I said, "Prepare, please light, have cars and vehicles light the landing area there for the helicopters." And they were
Right,
able
right.
to pick the accident victim, and you know we flew the victim to Makati Medical Hospital, and the name of
Mm-hmm.
uh, the victim at that time is Vandal, the son of Dolphy and Alma Moreno. But
Mm-hmm.
unfortunately, the girlfriend who was with Vandal did not survive. And so that was one of our medevac that we did at that time. But there were several from Bicol, from other areas
Mm-hmm.
in the lower mainland. But anyways,
Captain Med, care to share, like, maybe another story wherein, an air ambulance could have saved a life of a Filipino, of a regular Filipino. Like,
yes, we have several actually that we did. But
mm,
let's get on with this, because that was a for-profit organization, Philippine Air Ambulance. I'd really like to expound on this charitable S.T.A.R.S program that we are introducing now to the Philippines.
Okay, so how does the your current initiative? You mentioned about 911 and the concept in Canada. So how does this initiative integrate with the current emergency response system in the Philippines?
Well, the this will integrate by collaborating uh, with the local government, the 911, our hospitals and clinics.
Mhm.
Uh, in any emergency, especially during calamities, nowadays we got series of typhoons going in here. We will be coordinating with the disaster uh, management center, and the nice thing about if we can establish this, our assets are already in place, different places. If you say, the typhoon will be hit Batanes or Quezon, the helicopters are there already. We don't have to scramble them from Manila or from somewhere else, because
Mhm.
the nice thing about establishing this structure is when
Mhm.
there's no calamity, we are an emergency medevac helicopters for any transfer of patients or victims. And during calamities, we transform our helicopters because we will have hoist in our helicopters. Uh, it becomes an air rescue platform. And
Mhm.
the nice thing here is the training of our pilots and our medical personnel are for rescue and also medevac. Not like right now when we don't have. Yeah, we can use the military, but they're not
Mhm.
they're not trained to do all this medevac operations. And
Right.
one of the things our here, because we'll be operating this 24/7, is the training of our pilots on NVG, the night vision goggles, right? So that
Mhm.
and also IFR. So we fly 24/7 at night. As long as the weather will allow us, we will fly, we'll
Mhm.
pick up the patient, and hopefully save their lives. And this is very important. That we did this in Canada, and even
Mhm.
if it's going, as long as you know we have our GPS and our approaches to different areas. Uh,
Mhm.
we are able to save lives and help our people.
Captain Med, could you tell us more what kind of training or preparation is necessary for for the medical professionals and the pilots who will be involved in this project, Captain Med?
Yes, that's a very good question, Alex. As I mentioned earlier, if we establish here, one of the things that also we're establishing is the Philippine EMS Academy. It will be
Okay.
based in Angeles City or in Clark. The reason why we're doing that
Mhm.
is it's an extensive training. Our personnel, our crew, or the trainees will be accommodated near the airport, so that it's continuous training. So for pilots, it will have the basic mountain training, rescue operations, IFR, that's instrument flight training, flying at night, just like airlines, and also the NVG, night vision goggles training.
Night
So
vision
that,
goggles. Mhm.
yes, because you know our airline pilots, like the big airlines, they fly also in all kinds of weather, right? At night and stuff, but they land in runways, which has an approach, and they land on runways. Ours is, if you say we will pick up a patient in the highway of, let's say, going to Baguio, we will
Mhm.
get that from our GPS. And so our pilots now will try to land in a highway, which they haven't been there probably before at nighttime. So
Mhm.
training of our pilots are very, very extensive. And so with the medical uh, people that will be our personnel, paramedics and nurses and doctors. It's continuous. We have initial training, and we also have recurrent training every 6 months, right? I'll give you an example for our medical practitioner. Let's say a paramedic, we will hire paramedics who has an experience of 5 years in the tertiary hospital and ICU, and we train them for
Mm-hmm.
about a year. And then after that, after their initial training, we have constant training every 6 months. And any advancement in the medical field or even aviation, we integrate that in our training all the time. So we're very proactive and very high quality training.
So with this kind of training, there will be, of course, costs, right? That will be entailed. So, Captain Med, what are the funding sources or partnerships that will be necessary to put up this kind of project? So, let's say, are there plans for for government and or private sector
Yes,
partnership for this project of yours?
yes. Our aim in this project, as you know, Alex, is not to charge the victim or the patient. We call our
Correct.
patient VIP, very important patient, right?
Mhm.
And we don't want to charge them. So how we gonna raise the funds is through sponsorship, donations, patronage from private and public sectors. Our uh, collaborations with hospitals, clinics, and HMOs. HMOs, those are insurance, medical insurance. We would like also to tap on the tourists, because one of the things
Right.
is they come here, they go to Palawan or Boracay, and most
Right.
of these tourists they have medical
For
insurance.
medical insurance, travel
Yeah, they have medical
insurance. Yeah.
insurance most of the time. And how good is that if they cannot go to the hospital, right? So we
Mhm.
will cover that. Since we are scattered all over the country, we will be on standby for any tourist Filipino that will have an accident or they need a transport to the hospital. We'll pick them up
Mhm.
and put them there. So it's like an insurance for the tourist that comes to the. And we're hoping, if we can work it out with the government through
Mhm.
when they buy tickets, so we will say we'll tuck in $10 for a Medivac insurance, and that's what we're
Mhm. Correct.
trying to obtain. So our revenue streams are from donations, from the public and private, a little from the government. We would like to work it out with the government from their PhilHealth. These are contributing a certain percentage, very, very small percentage. We were thinking
Mhm.
of maybe 300 or 500 per, per person per year. Really, comparing to what the contribution there, I think that's very minimal. And for those who are not enrolled in the PhilHealth, maybe through the LGUs or so it will be work it out with the government at a minimum. That's what we're trying to do because the bulk will be raising our from donations because we want this organization as if it is owned by the community, by the Filipino people, because we are serving them, and we will not be qualifying them. Anybody who will have an accident, we will pick them up. We want to save them, and because of that, we will be very transparent on. Will be uh, we will have audits so that
Mhm.
the people knows where the money goes because we are asking donation from them and we will be fiscal responsible. That is what this organization is all about.
Captain Met, in your planning or in your initial stage of your project, did you encounter or see any regulatory hurdles or challenges, especially, I mean, right now excuse me, right now you are putting up the concept, right? So did you encounter any hurdles, or did you first will we first did you foresee a, you know, regulatory hurdles
Well,
as you go along? Yeah.
yes, that's a very good question, Alex. It's major obstacles we
Mm.
have here compared to when we established our medevac in Canada, because
Mm.
the Canada already have their emergency medical service law or act,
Okay, okay.
while in the Philippines we found out that's not existing yet. Uh,
Okay.
During my research, I look at for the last 20 years, a bill has been tried to pass in the House of Congress and Senate,
Mhm.
and it hasn't passed. So I did a research. I look at all the bills that was presented. That's why it was not passed, because it was
Mm.
inadequate in terms of the requirements for certification. Uh, Actual, there's probably lack knowledge of the regulatory uh, requirement and enforcement. And in fact, I found out that the 911 was just established during the Duterte government, and even now, it's still not as robust as what we would like to. So there's a lot of coordination, collaborations with the government in order to establish this properly and be able to operate safely. Uh, so, because I found out that we don't have a law or act on this one, I
Mhm.
worked out for about 2 weeks. I researched and I checked what the US and Canada had and the other countries.
Ha- okay.
And I patterned that to the Philippines, and I drafted a bill. And I'm hoping I could work this out with our lawmakers, and you know,
Lawmakers.
and they will realize how, how important this is. And I think it's patterned well enough that it will be affordable to the Filipinos, the way the bill is designed. So I would like the policymakers to have a look at that draft or that proposal, and hopefully, we can work it out and collaborate so that we can establish a robust emergency medical service in this country.
So this will be your message to the, congressman who will be watching this episode. What will be what will be your message to them, so that this concept of yours will be smooth, and of course we need to draft, in parallel, policies for it to work. So what will be your message to
Yeah.
our policymakers?
Well, my message to them is, have a look at the proposal that we have, and I'll be willing to sit down with them and say, okay, where do you think is better? Right? But the bottom
Mhm.
line is, we should be able to have an EMS law or act, so that
Mhm.
we have so many calamities here, from earthquake to volcanic
Mhm.
eruption to typhoons. How many series of typhoons we have here? We need this kind of service for our people, because there have been so many deaths, and every time we have calamities, I think it's time we
Mhm.
start saving lives. Even saving just one life, I think it's worth it for the Filipino people.
I think this is an appropriate message as well to our president, Bongbong Marcos. So if you have a message for him, you can, I think your previous message was already enough, but if you have a message for him now to, you know take a look at this initiative, what will be your message to the president?
Well, my message to the president is, let us work together with our lawmakers, the Congress and the Senate, and pass the bill. It's time that we will have a bill in this country here so that we can organize properly our 911 system, our medevac system, our air rescue system to save lives for the Filipinos.
Yes, thank you for that, Captain Med. So for our next question, we go over to the next one. So
Okay.
well, we've discussed about the funding. Now explain to our listeners na how does this initiative aim to ensure that that the costs of helicopter ambulance do not become a barrier for patients in need of emergency air transport. This is not just for regular Filipinos, but you plan to also expand this to, of course, the tourist, right? And according to our DOT, we have about, I think, more than five, if my numbers are correct, 5 million plus tourists that come here in the Philippines. So that's a lot of numbers, right? In terms of who will be needing this kind of service. So how do you
That's
make it sustainable? Yeah,
yeah,
so that the cost will not be a barrier for a regular
that's
Filipino
correct.
and
Like
a tourist. Yeah.
that's right. Uh, of course, operations like this, the cost is very, very important because, especially, we want this sustainable. Once
Mm.
we establish this, we want this sustainable that it will be even for the next generations, right? Because this will not change. Most developed countries and most countries in the world has this kind of service, whether it's profit oriented or non-profit oriented. Uh, we have this kind of service. It's very, very important. The air rescue and medevac, because it helps on also in our donor program. The organ donor program will be
Mm.
benefited by this kind of transportation. But anyways, yeah,
Mm.
sustainability will be very, very important because maintenance of helicopters is not cheap, and as I mentioned to you, safety is paramount here. So we want to properly maintain our helicopters, properly train our pilots and our medical practitioners so that we can do the mission properly of saving lives. So in order to do that, you mentioned about tourists. Yeah,
Mm.
5,000 tourists, let's say, if they can pay, through their tickets and whatever means,
Travel
$10.
insurance.
Yeah, insurance, travel insurance. I think that's not very much, to charge $10 for every visit here in the country, because as I
Correct.
said, would like to cover the whole of the archipelago, including the West Philippine Sea or
Yeah.
uh,
The major
Enham.
tourist, yeah, major
Correct.
tourist sites.
So cruise ships is starting in this country here.
Correct.
We encourage
Yes.
cruise ships to come here. When I was in Canada doing medevacs,
Mhm.
there have been so many instances wherein I was called at 2 o'clock in the morning to do a
Oh.
medevac and land in a cruise ship because somebody was having a heart attack. So we picked them up and we brought them to Vancouver General Hospital and saved these people.
Mhm.
Because a lot of these people who are going into the cruise ships are old folks, right? And
Correct.
you are in the ocean.
Retirees.
Yeah, there's no hospital there. So the only way that they can uh, get to the hospital is through an air ambulance, like a helicopter, because we can land on the deck of the cruise ship. And I pick up several, uh, of this patient from the cruise ship to the
Patients.
hospital.
Yeah.
Yes. So in order to do that, we, we envisioned of getting revenues from the tourists, also from our HMOs, the health insurance, a certain percentage there, which could be, we can have an agreement with them. But as I said,
Mm.
all this is establishing a little from the government, from hospitals, from the clinics or HMOs. And also, one of the things, by the way, is we have EDCAS. We have nine
Sites, EDCA
sites here,
sites.
and we will be covering all American soldiers, their families who will be there. We know that they have helicopters, but they're helicopters for war. They're helicopters not for medevac. So we will cover if they are
Right.
in, let's say they're in Bautista Air Base in Palawan. If they
Or
need
in
to go,
Cagayan.
we'll pick them up, or Lumbia and Cagayan de Oro, we'll pick them up. We'll bring them to the hospital because just like just like us, even in Metro Manila, if the Americans are here, they also will be confronted with the traffic, right? And the best
Mm.
way is by air ambulance to go to the hospital. I'll tell you how we do that here in Metro Manila because we have the worst traffic in the world. I read in one of the papers
Mm.
there. Let's
Mm.
say a patient in Antipolo is having a
Mm.
heart attack, and we have our base there, right? We have a ground ambulance, and we launch. They call 911 and they say, okay, this guy is having a heart attack. So our dispatch, aside from the 911, will be talking to them and saying, okay, from Antipolo to, let's say, this patient
Makati.
is Makati Medical or St. Luke's in BGC.
Mm.
Our dispatch already said, yeah, traffic right now is terrible. It's all red. You can see in the highway there, right? So
Mm.
our ground ambulance will tell our dispatch, we will go to the nearest clear area, or if there's a helipad close by, that's where the ground ambulance will take the patient. Our air ambulance will go to that helipad or where they can meet and pick up the patient and fly them to the so we, you know without going through the traffic in Metro Manila.
Which leads me to my next question. When we compare traditional ground-based emergency, compare them to an air ambulance. So based on your experience, what are the benefits in terms of patient survival rates? We talked about delays that will be caused by, of course, traffic, and then the distance of the patient to the hospital that they need to go. Is a minute, a big difference for a person, a life and death situation for a patient? If they
Yeah,
use air ambulance, will a minute be a difference, for them to to be saved, basically?
right. Yeah, that's a very good question. This medevac program really started because of uh, the golden hour, which the medical profession, they believe in that. If the patient is given medical attention or help within the hour, their survival rate and also the recovery rate is better. And so we believe in the golden hour. Although our target is half an hour, we would like to, treat the patient within the hour. So our
Within the
helicopter,
hour.
yeah, our helicopters and our ground ambulance are like moving ICU. Uh, that's why in the proposed bill that I have, the requirements of a ground ambulance is pretty high because that's the international requirement. So I put in that proposal what is the requirement. Why? Because we'll be catering to not only Filipinos, to tourists, to Americans, to Europeans, or any visitors that here. And
Mhm.
if they expect to pay an insurance, we should have that kind of standards. Not just like you see our ambulances right now. You can see just a van that was painted ambulance and with a flasher. And if you
Mhm.
look outside, there's not much equipment, right? In that bill proposed, all the equipment that is required, like an ICU, is there. On our helicopters, it will be twin engine helicopters because it will be flying at night and over water. It will have pop out floats so that
Mhm.
it goes down, it will not sink.
Mhm.
Also, it's flying ICU. So
Okay.
without breaking the rule, Our paramedics are trained, our nurses are so trained that they can almost do surgeries in that.
or inside a helicopter.
Yes, and that helicopter will be carrying blood, different types of blood, so that they can do,
Mhm.
blood transfusion right there. They can do blood, test and all the requirements.
Transfusion, yeah,
That's
blood
right.
blood
So,
transfusion.
so that being said, I know it's not cheap to do this, but we have to do this if we want to save lives. We have to be equipped. It's not only for show that we have uh, e- uh, this air ambulance, but it doesn't have the proper equipment. I tell you why this is very, very important. This is not common yet in the Philippines, but in Canada,
Mhm.
sometimes, of course, we're not God. We can't save every life, right? Some people will die on the flight or, when we pick them up. And we are prone, they will sue us. The family will sue us that, you caused the death of their relatives, right? But as long as we equip properly, we do our training properly, we do our due diligence, we do our best. And as I said, we're not God. We can't make everybody alive, right? So as long as we do our very best and save lives, I think we've done our best. That's just my thing.
Yes, Captain Med, we are experiencing right now, of course, the aftermath of a severe tropical storm. What's the name? Karina? What is it?
No,
Katrina?
no, no. It's
Catherine
Catherine,
or
Catherine,
Catherine? Yeah,
Catherine.
PH. Yeah, hashtag. So this is a very important question as well. How do you see this initiative or project contributing to the country's disaster response capability? Because this is such a big thing, especially to the president, that we are in need of rescue assets. Of course, we have the ground and we have the air assets. Will this augment our country's disaster response as well, because there will be a lot of people needing emergency and medical evacuations, right? We
Yes,
have around 9 people, I think, dead from the typhoon. Maybe out of those nine, if my number is correct, if they have
yes,
been given this kind of service, they would be alive, right? So, do you see this
yeah,
as an important factor as well in times of calamities and disaster?
yes. Your question, Alex, is timely, and I tell you, I watch the news
Mm,
every day while this typhoon because I can't go out anyways. It's flooding all
mm,
over the place. So yes, it will enhance our capability for rescue operations. I know our government has been spending a lot of money on, we call it NDRR,
NDRMMC,
risk
National
reduction disaster something, anyways. And
Yes, yes.
it's a lot of money, which is good because we're training our people. There are rescue operators out there with small boats and vehicles and other equipment. Really, really nice. And everybody is out there. The normal bayanihan of Filipinos, we're out there to help each other, right? Because the flooding and this typhoon is just terrible. It's ridiculous. But anyways, the problem with that is without the air assets is it slows them down. The ambulances cannot go there when it's flooding. When you have 8 feet of 10 feet of water, that's it. Your vehicles cannot move there anymore. Okay, we have boats, but they're limited, right? And also very slow. So if we have established the structure of air ambulance, we as soon as we know that the typhoon is coming, we convert this into an air rescue helicopter, right?
Okay,
We
yeah, that's a good, yeah.
yeah, we pulled out everything there that are ICU thing. Well, there will still be first aid stuff, but it becomes an air rescue. What does that mean?
Mm,
This helicopter has hoist. It will have a hoist, like so. when there's flooding, most people are now on the rooftop, right? Or
Correct.
they are
Yeah.
somewhere. They're no longer on the ground.
Somewhere
That's right. So
stranded
now our
on a rooftop.
yes, our helicopter will fly over there, and if we have to pick them up, we'll just use the hoist. Our operators, our paramedics will go down and start winching people to the helicopters and fly them to wherever, evacuation center or
Mm.
hospitals. And obviously, our priorities there are those who are very, very sick that has to be moved to the hospital. So we hoist them, put them in the helicopter, fly them to the emergencies or the rooftop helipad of hospitals. Because I tell you what, even in hospitals, if it's flooding in there, your ambulances cannot go there anymore. So the only way to go there is either by boat, and sometimes even the boat cannot go there, is our helicopters landing in the rooftop helipad. So that's another thing. If we will establish this, we will be looking at every hospital. We will be asking them, to have a helipad, possibly, or preferably it will be in the rooftop so that it's an elevated and it goes directly to the emergency department of that hospital.
Second to the last question, Captain Ned. So,
Yes.
how do you, envision this initiative or project in changing the landscape of emergency medical care in the country over the next 5 to 10 years?
Wow, that's a very good question. I tell you what, we will be enhancing, we will be, because we will not be operating by ourselves independently. We'll be collaborating with everything, the local government
Mm.
to the hospitals, clinics, 911, fire responders, because we'll be needing them.
Mm.
Actually, that's why we're establishing the EMS Academy there, because we'll be asking, let's say the firemen, we'll be asking them for a short training to go to the academy for preparation of helipad, including the latest technology in as first responder, right? On first aid, resuscitation, or whatever. It will be the training in the academy. That's one of the things that will enhance everybody. Also, we'll be having campaign on emergency procedures
Mm.
for the public, which is very, very important. They have to know that, and they will also be familiar how to prepare a landing pad
Mm.
and other stuff. So this will enhance a lot of the medical and also our rescue operations in this country here. And one of the things is, as I mentioned this already before, is the organ donor is one. Another one is our universal health care in this country here. It will enhance that. And with our, you know, with collaborations with them, and hopefully we can improve that. And so also they can help us, improve so that we will have the best practices in the industry. And I hope everybody will embrace and
Mm.
help us out in this program so we can save lives during calamities and also in daily life. Thank you.
So you mentioned about information campaign. So what you're doing right now is, of course, raising awareness, especially here on social media, right? Regarding about your initiative. Do you plan? What's your strategy in raising awareness outside or inside social media? Do you plan to
Well,
conduct like road tours to talk about air ambulance or this concept?
we will do all different media actually, but I tell you, Alex, your media is, I think, so far for me, is one of the best because you covered our first meeting at the PSE there. We were still called Philippine Air Ambulance at the time. And I tell you
Mm.
why. it's very powerful, your media, because I got phone calls from my colleagues in Canada and also from the Kingdom of Bahrain. They're saying, "Med, we watched your presentation there
Presentation, really.
in YouTube," and I said, "Wow, that's pretty amazing." So I'm hoping with this, plus your suggestion on the Facebooks and other social medias there,
Mhm.
enhance this will help our promotions. And as I said, we will try every media. We will have campaign. We will visit towns because we will have training there for the local responders.
Very good. Mm.
And if we're able to bring the helicopters here, obviously we will have campaigns every town. We will introduce the helicopter, we will introduce our people,
Yeah.
because what we want is knowing the community. That is the best one that we can do. If we know the community, we know what are their weakness, we can respond better to them. We have what we call in the stars the vigilant program. We're vigilant on all the weaknesses on the healthcare of our people so that we can respond a lot better. Thank you.
We'll be looking at a time wherein people are will feel safe, right? Just by looking at your helicopter in their town,
Yes,
just seeing a stars, will you call it a stars helicopter? And then if they see one, they feel more secure knowing that there will be this kind of help in times of not just calamities, but when they need medical attention and
that's
evacuation.
that's right.
That will be
So
one of your vision.
right. So even now, Alex, we're still an advocacy group right now, promoting to have an EMS in this country here and to bring in the STARS
Mhm.
program. So we'll be campaigning for membership. We'll be campaigning for sponsors, patrons, the different foundations and organizations here, especially hospitals. We'll be working with them in the advocacy uh, period right now, so that uh, it will start educating the public already on what this medevac and also air rescue, why it is important for us, for this country here. We have average of 20 typhoons, and in the world
More, yeah.
index, we are number one in the risk rating. So we should have this. I mean, it is a must. For me personally, I saved so many Canadian lives, and I always say, if I was able to save these people, I should be able to save Filipinos, right? To me, this country has given me a free education and a job, and a good job. So I think it's time for me to help out. And the only way I could do this is with the help of the public also, because we're doing this not even for just for ourselves. It's for the next generation, for this country. Thank you.
Okay, I wanted to ask the last question, but I think you covered some of it. But nevertheless, what message would you like to share to the people, to the Filipinos who will be listening to this podcast? Uh, some of them will be future partners of Stars Philippines. So to close this insightful interview, a closing message for the Filipinos, Captain Men, to the policymakers, and again, if you have a message to the president, you can say that as well.
Okay, just a sec. I
And then it
prepared something here,
go.
and I
Sige.
don't want to miss anything. So if you bear with me, let me read
Sure,
that
take
to
your
you.
time.
Is
Okay.
that okay? Let me just say that I can't find it here right now. Whatever. From here. So, anyways, Alex, I think this program will only work with the support of the public and our lawmakers. With the leadership, especially with our president right now. You know, uh, who's been trying to help as much as he can during these calamities. I think this will be a big help to our air rescue efforts. And uh, sorry, I'm just sorry, Alex. You can just hold this. I'm just looking for that.
Sure, take take your time. We can omit these parts. Yeah.
Yeah, because I think that's important. Okay, I found it. So my message is: I urge the
Mhm.
policymakers, healthcare professionals, and the public to collaborate on improving emergency medical care through air ambulance initiative. Policymakers' support can drive regulatory changes and funding for expanding air ambulance services in underserved areas. These are the rural, remote areas. The public's advocacy and awareness are crucial for the initiative's success. Promoting air ambulance services strengthens our healthcare system. The Air Ambulance Initiative is a shared responsibility that enhances our ability to respond to medical emergencies and ensure all Filipinos receive necessary care. Together, let's commit to saving lives and fostering a healthier future for everyone. Help us fly. Someday it may be your life we save. Thank you. Thank you, Alex.
And, and that wraps up our SITREP episode featuring our special guest, Captain Medin Velasco. And with that, we'd like to also ask you where can people find you on social media? Do you plan to do you have a Facebook page? Do you have a YouTube? Maybe you can tell our viewers where we can find more information about S.T.A.R.S Philippines, or you plan to put up a website as well, correct?
Yes, we're planning of having a Facebook, you know,
Page.
page there, also a website on our own.
Mhm.
However, we haven't been putting so much effort there because we're trying to work it out with the government right now. I think the
With
key
other.
here, yes, the key here right now is working with the government, and if we see that there's a positive thing, then we can start working on the social media. However, as I said, while doing that, this is still an advocacy group right now, and anything from the public, of course, is a moral, financial, or whatever support is a big help to the Stars Philippines. Thank you, Alex.
Thank you. And this is Sitrep and Mabuhay Philippines.